Hey guys, my name is Jeb Smith. I'm a PTA here at Premier Physical Therapy, and I'm here today to talk to you about back pain. Back pain is something that most of you out there have probably experienced at some point in time in your life or another. There's statistics that show that throughout their life, 80% of Americans will experience back pain of some type. Over 25% of Americans are experiencing back pain right now, and over 90% of back pain cases can be fixed with physical therapy treatment in as little as 6 weeks. One of the things I want to talk to you today is some stretches we can do, some things we do here at Premier to help with your back pain. So we're going to go to CJ and I'm going to show you some stretches you can do at home if you're having back pain. So we're going to have CJ lay down here and we'll show you these in two positions, seated and laying. So the first one we're going to do is what we call a knee to chest. Okay, so all CJ is going to do is he's going to bring his knee up toward his chest and grab it with his hand and just kind of pull on it and hold it for a few seconds and then let it down. And he's going to go to the other side and do the same thing. What I usually tell people is you want to do about 30 of these each leg twice a day to help out with that back pain. What we're doing here is we're trying to stretch those muscles that are kind of your glute muscles and your low back muscles that can get tight. All right. Next one we're going to do is what we call a lumbar rotation. So he's going to start in the same position, knees are up, feet together, and he's just going to rotate his legs side to side. What he's going to try to do here is keep his shoulders flat on the table so he's getting as good of a stretch as he can. You can see he's rotating here, stretching out those low back muscles. A lot of places, a lot of us get tight day in and day out. Okay, same thing, 30 times each direction, about 2 to 3 times a day. Last one I want to show you today stretch-wise is called the piriformis stretch. So what he'll do is he'll take his leg, we're going to have him take his right leg and cross it over his left. Then he's going to reach up with his left hand and grab a hold of his knee, and he's just going to pull it toward his shoulder. Okay. What I usually have patients do is do this for about 30 seconds, 3 times each side. Now, if you're still experiencing back pain, but you've got a little bit more mobility like CJ does here, another way we can do this is keeping his leg like this and pulling this knee toward his chest. So this is just a little bit deeper stretch to stretch out those same muscles in that hip. Okay. So we'll have him go ahead and relax there for me. And I do want to show you those 3 things seated as well. So I'll have CJ come over here to the chair. And the first thing we'll do is his knee to chest. So we'll just have him bring that knee up, pull and hold it, and back down. And this is something I would recommend doing these lying down if you're capable of doing so, but sometimes people are uncomfortable in that position, so this is what we have them do instead. So this is his knees to chest, and he'll relax there. And his rotations, I will just have him sit up tall and turn side to side as far as he can, just rotating that trunk side to side. It's a little bit different than when we rotate the legs, but it still achieves the same effect. And then last but not least, the piriformis stretch. He's going to cross that leg, there we go, up over top. And there's 2 ways to do this one. You can either hug your knee to your chest, or you can bend forward toward that knee, whichever one you feel more comfortable with. I know sometimes, a lot of times with low back pain, we have some knee pain associated with it, so sometimes one way or the other does seem to work better for most people. We've shown you some stretches today that'll help you with your low back pain. Low back pain is something that affects people of all ages. It is not just older people or people who are working all the time. It's people who sit at a desk, people who work construction, kids. Anybody can be affected by this. We've got other treatments other than the stretches we've shown you today to help with your low back pain. We have things such as dry needling, cupping, the uplifter, A-stem, and massage that have all been proven to help reduce low back pain. So if you're experiencing low back pain, come out to one of our Premier Therapy Centers today so we can help you get better.